Hello, Mrs. Blackman-Hill and myself are here to demonstrate a basic head-to-toe assessment that you'd be performing on a patient in clinical, and certainly that you'll practice here in the lab. Our goal here today is to show you how generally in about 10 minutes you can assess and talk to your patient, collecting both subjective and objective data to get a sense of how the patient is for the day, and that information will help you determine your plan of care. This is not designed to be a comprehensive assessment. I'll be asking some questions. She generally is a patient who's here. She's come to subacute rehab. We'll say maybe that she's, maybe about 80 years old, just to pick a number. And she was hospitalized for pneumonia, and she got deconditioned while she was in the hospital. She was pretty sick. So she's here for rehab to start to get a little stronger so that she can return home and live independently. One of the things I'd like to point out is certainly I did wash my hands, but I'll be doing hand hygiene again before I begin. And when I use my stethoscope, I'm going to take it out of my pocket, I am going to clean it, and I'm going to leave it in place while I'm assessing the patient. I'm not going to take it on and off from around my neck or anyplace else, because while I'm using the stethoscope, I want to try to be organized and efficient. We encourage students always to use the assessment resources that you have within your course. You have multiple different guides that can be helpful as you practice yourself. I'm sure I will do some things that will vary from some of those guides, but that's really the way things are. We adjust what we do based on our patient situation, the things that we say, and also the detail in which we examine the patient. If she had some specific complaints, then I would go in, or any nurse would go in and do a more focused assessment to get additional details. But our plan today is to just see how she's doing. She's come to rehab after having been in the hospital undergoing treatment for pneumonia. So I'm going to get started, and I always come in, perform some hand hygiene. And the thing that before I actually start that I am looking at is the general survey for her. When the general survey, I'm looking at her posture, her position in bed, her grooming, does she seem to pay attention to me, how she just moves about in bed, all those things that I'm not going to, you won't see me specifically looking at, but the nurse is doing that when they come in to see this patient. I'm going to clean my stethoscope. And we're going to get started.
Okay.
Hello.
Good morning.
My name is Linda. I'm going to be your nurse for today.
Oh, okay, Linda.
For your safety, could you tell me your name and date of birth?
Yes, my name is Laura Wilson, and my date of birth is 2/12/32.
Okay, thank you. Well, today I just want to ask you some questions and do a little examination to see how things are going.
Oh, okay.
Okay. I'm going to raise your bed up a little bit. So how are you doing today?
Well, I'm feeling a lot better than I felt when I first got in.
Okay.
A lot better.
Good. Are you having any pain or discomfort?
No, not at this time.
Okay. How would you say your spirits are?
Well, pretty good. I'm looking forward to going home and seeing my
Okay.
family.
Okay, because in addition to looking at your physical side, we like to see how you're kind of coping with everything. I know you've been in the hospital.
Yeah, it's been an experience, but I'm feeling much better.
Okay.
Much better.
All right, well, glad to hear that. Because really, when we're all finished, one of the things we'll want to do is try to outline what the plan of care is for today.
Oh, okay.
Okay.
That will be good.
All right, so I'm going to start. Are you having any pain or discomfort?
No, I'm not.
Okay,
My chest feels much better.
good. Okay.
Much better.
And how did you sleep last night?
Well, it's a little noisy in here, so it was off and on. That's why I can't wait to get back home.
Okay.
But other than that, my sleep was good.
Okay. I'm going to ask you a few questions really about your nervous system, and some of the questions might seem a little silly, and you've already
Okay.
told me your name, so now I have to ask you, tell me where you are, please.
Oh, I'm at the Rowan Hospital.
Okay. And what's the date today?
Oh, I think today is the 16th.
Okay, how about the month?
It's May.
Okay, and the year?
It's 2018.
Okay, like I say, these questions seem really silly, but sometimes when you're, out of your normal routine, it's easy to lose track of the
Oh,
day
yes,
of the
it
week
is.
sometimes.
Yes.
So what's the day of the week?
Today is Tuesday.
We all have to think about it. I include myself
It's
there
Tuesday.
too. Okay, all righty. I'm going to start. Could you take your glasses off for a
Sure.
minute? And generally, do you wear your glasses all the time?
All the time.
Okay, is your vision pretty good with them?
Yes, it is.
Okay, and it seems like your hearing is okay.
My hearing is good.
Okay, alrighty, I'm gonna shine a little light in your eyes.
Okay.
Okay, I'm just looking at your pupils. Okay. While I have my pen, I'm gonna ask you to open your mouth, stick your tongue out and say ah.
Ah.
Move your tongue around a little bit. Okay. Looks like your oral cavity, your mouth is nice and moist. We always worry, make sure that our patients get enough to drink when they're here.
Oh,
Okay, we don't
okay.
want anybody getting dehydrated.
Oh, they've been giving me pictures of water.
Okay.
Yes, yes.
Alrighty. Okay, I'm just gonna look at your head.
Okay.
I'll put this rail down here. Any headache or dizziness?
No?
Okay, any irritation? Anything here at your ears? Did you have oxygen when you were in the hospital?
Yes, I did.
Okay, and I see you're not wearing it now, and you told me
No,
your
thank
breathing seems
goodness.
better, so it seems like
Yes.
things are coming along.
Much better.
Okay. How is your breathing? You said it's better. Cough? Are you coughing at
I
all?
cough every once in a while, not as often as I was coughing before.
Okay. Are you bringing up any mucus, any sputum?
No, not anymore. I was, but not
Okay.
anymore.
Alrighty. How about with activity? When you move around, how is your breathing then?
Well, it's not bad. I just go back and forth to the restroom, the
Mhm.
bathroom. Other than that, I really don't do a lot of walking. My daughter comes and I walk back and forth down the hallway with her, but I'm taking it slow.
Okay. Okay, kind of pacing your activity according to
Yes.
your energy level.
Yes.
Okay, because sometimes, especially after pneumonia, you get tired more easily, and sometimes you can
Yes, I do.
get a little short of breath.
Yes, I do.
Okay.
So I'm just taking it a little slow.
Okay. All right. I'm just going to feel your pulse here.
Okay.
I understand the nursing assistant has already taken your full set of vital signs.
Yes, she did.
And everything looks to be okay. I'm just going to be feeling your pulse. Your hands are nice and warm. Okay. I'm going to listen to your heart.
Okay.
Okay, I'm just going to untie your gown here for a moment. And you'll feel me move the stethoscope around a few different places,
Okay.
and then I'll pick one and I'm going to count it for a minute. Okay, take some nice deep breaths in and out. Okay, I'm just going to come around here from the side. Thank you. Looks like you're able to move around in bed pretty good. That's
Mhm.
okay. Okay, just listen over here. Okay. Could you sit up for me? I'd like to
Sure.
listen in the back.
Mhm.
Big breaths in and out. Okay. Any problems here in your back, any place I touch?
No.
Okay. How about when I tap over here? That's just checking over your kidneys for any tenderness.
No.
Okay. Okay, you can sit on back. Well, I have my stethoscope right. I just want to check your belly.
Okay.
How's your belly feel?
It feels good.
Are you hungry?
Yes, I am.
Oh, always a good sign. Just listening for some gurgling.
Oh, okay.
How have your bowels been?
They've been good.
Okay, even though it's one of those personal questions we like to know and make sure that your bowels are working what is normal for you. So when's the last time you had a bowel movement?
Oh, it was this morning.
Okay, and what did it look like?
Oh, I really don't look at that, but I think it's pretty much the same.
Okay, brown formed. It is really a
Yes.
good idea to take a look, just in
Oh,
case you
I
ever had
didn't
any
know.
blood or anything like that. If you don't ever look, you
Oh.
wouldn't know if there was any change.
Oh, I didn't know that. Thank you.
Okay, and how about urinating?
Oh, I did that as well.
Okay, any
Mhm.
difficulty urinating? Any burning, pain,
No.
discomfort? Ever lose control of your bladder when you don't want to?
No, I don't.
And ever any leaking, anything like that?
No.
Okay, alrighty. Any issues with your skin?
No.
Any concerns, any itching, dryness, any of those kind of problems?
Oh, I'm a little dry in the winter.
Okay, we'll make sure that we have some moisturizers here.
Okay.
I'm going to ask you to kind of just lift your arms up, put them
Alright.
up high. Just kind of want to see how they move around in a circle. How about the other one? Good. Hold your arms out straight in front of you. And don't let me push them down. I want to see how strong you are.
Okay.
Okay. Good. Okay. Hold the palms up. Close your eyes. And just hold them up a few minutes, or a few seconds, really. Okay, good. Relax. You can relax your arms. Now I'm just going to I'm going to try to straighten them and you bend them. Again, checking to see how strong they are, if you have any problems with your joints.
Okay.
Oh, pretty good. Good. Squeeze my hands. All right. Are you bothered by any arthritis, anything like that?
No, I'm not.
Any numbness or tingling in any of your arms or your legs or any extremities?
No.
Okay. And how about walking? Are you aware of any kind of weakness, anything like that?
No, I'm not.
Okay. And prior to this episode with pneumonia, you were able to do everything independently yourself?
Yes.
All your self-care, bathing, showering, walking, all those kinds of things?
Yes, thank
Okay.
goodness.
And so now one of the reasons you're here is for us to help you get back to that same level.
Yes,
And
yes.
kind of basically get your energy up.
Yes,
Okay.
that's my focus.
Alrighty, I'm just going to check your belly here.
Okay.
It looks nice and flat. Any pain or discomfort? Any tenderness?
No.
Nice and soft. Okay, any issues, any of your skin folds?
No.
Okay. And just check your legs. I know I make a mess of the bed, but we'll fix it. Okay. Nice toenail polish.
My daughter did those.
Okay, just checking your circulation, feeling your pulses. Also looking to see if your legs are the same size. They appear to be. Are you ever aware of any swelling?
No, I'm not.
Okay, can you push down against my hands? Good. Can you lift this leg? Lift the other leg? Can you lift them both together? Good. Okay. Can you just bend your knee, slide your leg up, and straighten it on down? Good. Same thing with the other one. All right, looks like everything is working pretty well.
Oh, good. Good. I'm
Okay.
glad to hear that.
All righty. Next thing, one of the last things I'd like to do is see how you do in terms of moving in bed and getting out of bed. So first, can I ask you to turn over on your side so I can just check your back a little bit more
Sure.
thoroughly?
Which side do you want me to turn on this?
If you can turn that side, if you don't have a
Okay.
preference.
All right.
Okay, because I just want to check your skin. Sometimes when you're in bed, we don't want any kind of problems to crop up.
Oh, all right.
Okay, all right, good. Come on back. I'm going to lower your bed down now. Now, have you been getting up out of bed? You mentioned walking in the hall with your daughter.
Yes, I do.
going to the bathroom? Have you been going in by yourself or
Yes,
you
I-
call for help?
Well, I've been calling for help.
Okay.
Yes.
Well, let me, if I can, let me just see how you do in terms of starting to get out of bed. Can you swing your legs over the side of the bed?
Oh, okay.
Oh, let's get your slippers for you.
Okay.
Okay. All right. And can you stand up? I'm right here just in case you need help, but I want to see
Okay.
how good you are by yourself.
Okay, I'm just going to wait a minute.
Good idea.
Okay.
All righty. Any dizziness or anything now? All right. Thank you. Do you have to go to the bathroom?
No, I don't.
Okay, well, you can sit back on down. Alrighty, so today we'll talk about what the goals are and the plans of what is on the agenda.
Okay.
And what things that you're concerned about and any questions that you might have.
Okay, I just want to get back to my normal
Okay.
activities when I go home because I'll be taking care of myself.
Okay, all right. Well, breakfast is coming down the hall.
Okay.
So after breakfast, we'll kind of work out the details of the day and make sure you know every activity that's going on.
All right, well,
Do you
thank
have any other questions for me?
No, Linda, I don't, but
Okay.
thank you so much.
Alrighty, are you comfortable here or do you want to swing your legs back up?
I think I'm going to get back in the bed.
It's early, huh?
Yes, it is.
All right. Okay, rails are up. You know how to work your bed, and your call aid is right here. Please call us if
Yes.
there's anything you need.
Okay.
And your bed's certainly back down in the same position.
Thank you. It
All
was a
right.
pleasure meeting you.
Okay, well, I'll be in and out all through the day.
Thank you so much.
Okay, take care. Okay, so that is kind of basically our assessment. She really did not have any significant problems or things to address right now. Hopefully her rehab will be uncomplicated and she'll get back home where she wants to go. Thanks for your attention. Certainly, always continue to practice, work with your faculty to help you improve your skills, and give feedback to each other. I'm sure if you were to critique this assessment, there are some things that you might find that you would correct in my appearance. I noticed that I touched my hair in the middle to pull it behind my ear while I was working with the patient, which really I shouldn't have done. That's why we always want you students to have their hair back out of their face. And if there are other things that, other constructive criticisms that you identify, certainly you can discuss them in class or in lab with your faculty. But know that we'll never be perfect and we do the best always that we can to take care of our patients. Thanks for your attention. Ms. Blackman-Hill, do you have anything to add?
No, I don't, but thank you for viewing this presentation with Dr. Canonica and I.